Welcome to today's deep dive. I want you to start by thinking about something you are doing right now, without even realizing it.
Oh, this is a good one.
Yeah, over the next 10 years, your body is going to secretly replace your entire skeleton, piece by piece.
Which is just wild.
Right. You won't feel it happening, you won't see it. But a decade from now, the bones you're sitting on, the bones in your hands, the bones holding up your skull well, they will be fundamentally brand new.
It really completely shatters the illusion we have about our own anatomy.
It really does. I mean, I always treated my skeleton like it was just this, internal coat rack.
Yeah, a lot of people do.
You assume it's this static, dead scaffolding that your muscles just happen to hang on. It does its structural job. It holds you upright. And, well, as long as it doesn't snap in half during a ski trip or something, you basically ignore it.
It really is the ultimate background character. I mean, we pay attention to the heart beating, the lungs breathing, the stomach digesting.
Right.
But the skeleton just seems like the concrete foundation of a house. It's just there.
But today, we are looking at a stack of medical terminology and history notes that are entirely focused on a single root word, which is osteo, meaning bone.
Yep, exactly.
And our mission for you today is to decode this 2,400-year-old secret language that is honestly just hiding in plain sight. It's written on your medical charts, it's tossed around in hospital hallways, and it's embedded in prescriptions all over the world.
And, the goal here isn't just to memorize a flashcard for some biology quiz.
Definitely not.
Understanding this single root word is really a master key to radically redefining a part of the human body that you take for granted every single time you take a step.
Yeah, by the end of this deep dive, you will understand why thinking of your skeleton as a simple piece of architecture is just completely wrong.
Okay, let's unpack this.
Well, to truly grasp the medical vocabulary of bone, we first have to, understand the material itself.
Because the scientific understanding of bone has undergone this massive paradigm shift over the centuries. If you look at how the root osteo is used in our sources, there is a strict anatomical definition.
Yeah.
And then there's a broader clinical definition.
Okay.
So strictly speaking, osteo refers to osseous tissue.
Osseous tissue. Let's break that down for me. Is that just a fancy medical way of saying the hard, white stuff?
That is part of it, yeah. It is a highly specialized connective tissue. It actually starts with a flexible collagen matrix.
Like flexible.
Yeah, think of that like the steel rebar in a building foundation.
Oh, okay.
Then that matrix is hardened with calcium phosphate crystals. Specifically, a mineral complex called hydroxyapatite.
Okay, so it needs both the flexible rebar and the hard concrete. Because I guess if it were just calcium, we'd just shatter like glass every time we jumped. And if it were just collagen, we'd be bendy like rubber.
And that is a brilliant way to put it, actually.
Yep.
So at a microscopic cellular level, the strict definition of osteo is just about that hardened, mineralized material. But clinically, when a doctor uses a word with osteo in it, they usually mean the entire living organ.
Meaning, like, a femur isn't just a stick of chalk.
Far from it. When a radiologist is looking at a bone scan or a surgeon is operating, they are dealing with the whole package.
Oh.
You've got the marrow churning inside, the complex network of blood vessels running through it, the web of nerves, and that fibrous protective covering on the outside. It is this densely packed, living ecosystem.
Which brings up a really fascinating piece of history from the notes, actually, because for a very long time, the medical world really did think of bone as just dead wood.
They absolutely did.
Yeah.
I mean, if you go back to the 19th century anatomists who were working before modern cell theory was fully established, they treated the skeleton as completely inert scaffolding.
Just dead weight.
Right, because a dried bone on an anatomist table just looks like a rock. So they assumed it was dead architecture that, only happened to be alive at the very, very edges where the drains connected.
I mean, I understand how they made that mistake. You look at a skeleton in a museum and it definitely doesn't look alive.
Right, exactly.
But 20th and 21st century biology completely overturned that. Bone is actually one of the most metabolically active tissues in the entire human body.
Yes.
Instead of a museum exhibit, I want you listening to visualize a major metropolitan city under endless, chaotic construction. It is a job site that never, ever closes.
I love that visual. And the medical grammar of this root word actually maps perfectly onto your construction site analogy. The vocabulary gives you the names of the different crews working on that job site.
Okay, I want to test this. So if I'm looking at my medical chart, how do we know who the builders are?
You look for the suffix blast.
Okay, blast.
Right, blast cell is an immature cell that builds tissue. So osteoblasts are your builders. They are the microscopic crew out there actively laying down new, fresh bone matrix.
Okay, so osteo means bone, ostblast means builder, osteoblast, got it. But, I mean, if they just keep building forever, our bones would become massive and super heavy, right? There has to be a crew clearing out the old stuff.
And that is exactly where the suffix class comes in.
Ah.
It denotes a cell that breaks things down. So the osteoclasts are your demolition crew.
Demolition crew?
Yeah, their entire evolutionary job is to resorb or essentially dissolve old micro-damaged bone tissue to just clear the way for the builders.
So you've got builders and a demolition crew constantly fighting over the terrain, but do they just run around randomly, or is someone actually managing this?
There is a site manager, thankfully.
Yeah.
That brings us to the suffix site, which simply means a mature cell.
Okay.
So osteocytes are mature bone cells that have actually become embedded and, well, trapped deep inside the hard matrix they help build.
Trapped.
Yeah, but they aren't dead. They act as this incredible, interconnected mechanical sensor network. So when you go for a run, the osteocytes feel the physical stress on your tibia, and they send chemical signals to the builders and the demo crew, telling them exactly where they need to reinforce the bone.
That's amazing. And the result of all that cellular coordination is the statistic we opened the show with. The push and pull of the osteoblasts building and the osteoclasts breaking down means roughly 10% of your adult skeleton is entirely replaced every single year.
It really is a phenomenal feat of biological engineering.
So if we have this hyperactive construction site happening inside us at all times, what happens when the foremen just lose control of the crew?
What's fascinating here is how this high-speed cellular construction site perfectly explains the actual diseases and risks we face at different stages of life.
Right.
Like the vocabulary of the workers explains what happens when they get out of balance.
Well, let's use the adolescent growth spurt as an example. One of the terms in the source material is osteosarcoma. Now, I know the suffix oma usually means a tumor, so we are obviously talking about a bone cancer. And the notes say osteosarcoma is the most common primary bone cancer in teenagers. Why teenagers specifically?
Because it peaks precisely between the ages of 13 and 16. Think about your construction site analogy, right?
Yeah.
During puberty, your bodily assembly line goes into absolute overdrive. I mean, you are growing inches in a matter of months.
Oh, right.
So that means those builder cells, the osteoblasts, are dividing frantically to lengthen the bones in your arms and legs.
And I guess the faster a cell divides, the more dangerous it gets.
Fundamentally, yes.
Yeah.
Whenever cells are dividing that rapidly, the statistical odds of a genetic typo occurring while, copying the DNA, they just skyrocket.
Wow.
So the sheer frantic speed of the osteoblasts during that pubertal growth spurt is the biological mechanism that directly explains the epidemiology of the cancer.
The biology perfectly explains the statistics. That makes total sense. But if youth is about the builders moving too fast and making a catastrophic mistake, what happens when we look at the other end of the age spectrum? When those builders inevitably start to slow down.
Well, then you encounter the silent epidemic of aging, which is osteoporosis.
Let's break down that word for me. Osteo is bone. What is porosis?
It means a porous condition, a condition full of holes.
Yikes.
Yeah, and this affects an estimated 200 million women globally. The International Osteoporosis Foundation notes that an osteoporotic fracture happens every 3 seconds somewhere in the world.
Every 3 seconds? That is a staggering number. Why does it happen so frequently?
It occurs most prominently post-menopause. You see, estrogen acts as a crucial regulatory signal to your bone cells.
Okay.
So when estrogen levels naturally decline, the balance on the job site just shifts. The demolition crew, the osteoclasts, they start working much faster than the builders, the osteoblasts. Yet your body is literally dissolving more bone than it is replacing. So the solid, dense mineral matrix becomes brittle, fragile, and porous.
And the stakes there are just incredibly high. I think there is a common misconception that breaking a bone when you're older is just, an inconvenience.
Right.
Like you wear a cast for a few weeks, you watch some daytime television, and you heal. But the data in our sources paints a much darker picture. Mortality jumps significantly in the year following a hip fracture in older adults.
It is a profound physiological shock. A major fracture in an older adult can lead to prolonged immobility, which then invites blood clots, pneumonia, and a massive loss of muscle mass.
Right.
It is a cascading systemic event, and it all starts because the microscopic demolition crew just outpaced the builders.
I do have to push back on something here, though. I'm looking at another term in the notes. Osteomyelitis. The suffix myel refers to marrow, and oscuditis is inflammation, so a bone and marrow infection. But our sources say that during the Civil War and World War I, an infection inside the bone was basically a guaranteed amputation or a death sentence.
Yep.
But you just told me bone is this heavily armored, mineralized fortress made of hydroxyapatite crystals. Shouldn't armor keep invaders out?
It is the ultimate fortress flaw.
Really?
Yeah, the very thing that makes bone incredibly strong is exactly what makes it so vulnerable to infection. Those thick, mineralized walls mean bone tissue has very poor blood perfusion compared to your soft tissues, like your muscles or skin.
Ah, so blood can't easily flow in and out of the dense areas.
Yes. So if a musket ball in the Civil War, or even just a compound fracture, manages to introduce bacteria deep into the bone cavity, that poor blood flow means your body's immune cells, your white blood cells, can't easily reach the battlefield.
Because they're physically locked out.
Exactly.
What about later on? Did the invention of antibiotics fix that?
Even after antibiotics were widely deployed in the 1940s, osteomyelitis remained incredibly difficult to treat. Yeah, getting an intravenous antibiotic drug to penetrate through that dense mineral matrix and reach a sufficient concentration in the infected marrow is extremely challenging.
Wow.
The physical material properties of the osseous tissue directly dictate the life or death clinical reality.
Here's where it gets really interesting, though. We've spent time exploring how this word functions biologically, inside the body. But the history of how the root osteo actually survived to enter modern hospitals is a wild story all on its own.
The root itself has remarkable endurance. It goes all the way back to the Hippocratic corpus in the 5th and 4th centuries BCE.
That's ancient.
Yeah, ancient
Wow.
Greek physicians were using the word osteon to describe their methods for treating fractures and setting limbs.
It's just amazing to me that a 2,400-year-old word coined by ancient Greeks is still doing daily rounds in state-of-the-art medical facilities.
And it was continually formalized by early medical pioneers, too. Andreas Vesalius featured it heavily in his groundbreaking 1543 anatomy text, De Humani Corporis Fabrica. And then, in 1741, a French physician named Nicolas André de Bois-Regard coined a new term that changed surgical history: orthopedics.
Wait, slow down. Orthopedics doesn't have the root osteo in it anywhere.
It doesn't. André coined it from orthos, meaning straight, and paidion, meaning child. Literally, the practice of straightening children.
Straightening children.
Yeah, his focus was entirely on preventing and correcting skeletal deformities in youth.
So treating things like severe scoliosis or bowed legs.
Yes, but that newly coined term gave birth to an entire surgical specialty organized completely around the skeleton. And all the surgical vocabulary that evolved within that new field was built right back on top of the ancient osteo root.
Oh, I see.
For instance, an osteotomy, where a surgeon intentionally cuts a bone to realign it.
Okay, so that's the conventional surgical side. But the notes highlight a second origin story for this word in modern medicine, and it is a fascinating pivot. It starts on the American frontier in 1874 with a physician named Andrew Taylor Still.
Still's story is rooted in unimaginable tragedy, actually. While practicing in Kansas, he lost 3 of his children to spinal meningitis in rapid succession.
And he was using the absolute best conventional medical treatments of his era to try and save them.
He was, which we have to remember, were brutal by today's standards. Conventional 19th century medicine relied heavily on aggressive bloodletting and prescribing highly toxic heavy metal compounds like mercury.
Still was just utterly devastated, and through that grief, he became completely disillusioned with mainstream drug-heavy medicine. He came to believe it was actively harming people more than it was healing them.
So he proposed a radically different philosophy. He believed that the musculoskeletal system was the absolute foundation of all human health. In 1892, he founded the American School of Osteopathy in Missouri.
He literally took the root osteo and used it to name a brand new school of medical thought. He believed that physically manipulating the bones, the joints, and the musculoskeletal structure was the key to unlocking the body's natural ability to cure disease.
And this historical divergence leads to what is arguably the single biggest point of confusion for patients encountering this word today: the root fractured into 2 completely different realities.
Time out. Before we get into the split, we need to make something very clear to you listening. We are absolutely not endorsing either viewpoint here, nor are we taking a side in any debate between conventional medicine and alternative therapies.
Definitely not.
Our goal is strictly to impartially report what our historical source material says about how this medical terminology split, because it genuinely trips people up depending on what country they live in.
That is a crucial distinction to make. because the legal and medical reality of the word actually changed depending on geography.
Right.
In the United States, American osteopathic medicine evolved significantly over the 20th century to integrate with modern science. Today, a DO, a doctor of osteopathic medicine, is a fully licensed physician.
Okay.
They complete equivalent rigorous medical training, pharmacology, surgery rotations, and licensing exams as an MD, just with the addition of learning osteopathic manipulative treatment.
So in America, a DO is your pediatrician, your surgeon, your emergency room doctor.
Exactly. However, if you travel to the United Kingdom, continental Europe, or Australia, the term osteopath typically refers to a manual therapy practitioner who does not possess full conventional medical training.
Wow. Okay.
Their practice remains much closer to Andrew Taylor Still's original 19th century vision of hands-on musculoskeletal manipulation.
So one ancient root word resulted in two completely different legal and medical realities. If you look for an osteopath in London versus an osteopath in Chicago, you are walking into two entirely different levels of medical licensing.
It is a very rare case where a standardized, universally recognized medical root split into non-equivalent professional meanings based entirely on borders.
So what does this all mean? How do you, the listener, actually use this vocabulary to navigate your own health and decode your own medical charts without getting tripped up by misconceptions?
Well, if we connect this to the bigger picture of our medical vocabulary, the first step is clearing up the most common point of confusion patients face when they hear a diagnosis.
Yes, let's settle this one definitively. Osteoporosis versus osteoarthritis. People mix these up constantly.
It is completely understandable given how similar they sound, but the root words tell you exactly what is happening mechanically. We know from earlier that osteoporosis means a loss of bone density.
Right, the holes.
Yeah, the mineral matrix is thinning out because the demolition crew is too active.
But osteoarthritis brings in a new neighboring root word, arthro, which means joint.
Yes. Osteoarthritis is not about the bone density thinning. It is about the mechanical wear and tear, the degeneration of the slippery cartilage that cushions the surface of a joint where two bones meet.
Oh, okay.
When that cartilage wears away, the bones rub together, causing secondary changes in pain.
So you could have osteoporosis and have incredibly fragile bones, but your joints feel totally fine.
Exactly.
Or you could have osteoarthritis with terrible knee joint pain, but your actual bone density is rock solid. You can have one, both, or neither.
They are entirely distinct biological mechanisms, and the root words reveal that distinction instantly.
And that's really the secret to decoding your medical chart. Osteo almost never works alone. It's always sitting in a neighborhood of other terms. You just mentioned arthro for joint. There's also chondro for cartilage.
A great example of that is endochondral ossification.
What's that?
That is the biological process where most bones in the human body actually start out as cartilage when you are a developing embryo and are later replaced by hard bone.
Wow. Or look at the prefix peri, meaning around. If you've ever banged your shin on a coffee table and felt that blinding, sharp pain, you are feeling the periusosivum.
Oh, yeah.
That is the dense fibrous membrane wrapping around the outside of the bone, which is packed with nerves and vital for blood supply. And speaking of pain, you can't forget the suffix algia. Osteodynia, or ostealgia, is the clinical term for bone pain.
And perhaps the most constant clinical companion in the chart isn't even a Greek sibling. It's the root calci for calcium.
Right, calcium.
You simply cannot discuss the pathology of bone without examining calcium levels and vitamin D metabolism, because vitamin D is what allows your gut to absorb the calcium the builders need.
And this is why this vocabulary matters to you. This isn't just some abstract history lesson. When you have an aging relative who goes in for a DEXA scan to check their bone density, you now know that is an osteo question.
And when a youth athlete comes off the field complaining of unexplained deep bone pain that won't go away, and the doctor suggests screening for osteosarcoma, that is an osteo question.
When you are discussing menopause hormone therapy with your doctor, or just standing in the grocery store aisle wondering if you actually need to buy those vitamin D supplements, these are all questions about supporting those cellular builders and demolition crews working away inside you.
Understanding this 2,400-year-old vocabulary just gives you agency in those modern conversations. It demystifies the chart.
We've covered incredible ground today. We traced a single word from Hippocrates treating fractures in ancient Greece through the Renaissance anatomy labs to a devastated doctor searching for answers on the Kansas frontier, all the way down to the microscopic builders replacing 10% of your skeleton right now.
This raises an important question, though, because as we mentioned earlier, Our understanding of bone isn't settled. It is still shifting.
I'm glad you brought that up because there was a detail in the research notes that I have not been able to stop thinking about. It goes back to the site managers, the
Osteocyte,
osteocytes.
the matured sensor cells trapped in the matrix?
Yeah. Modern research shows that osteocytes don't just sit there feeling mechanical stress and managing the construction site, they actually secrete hormones.
They do.
The notes highlight one called FGF23, which travels out of the bone through your bloodstream and talks directly to your kidneys to regulate phosphate levels.
Right. Because of functions like that, bone is now classified, in part, as an active endocrine organ.
Which is just mind-blowing. If bone isn't just structural scaffolding, but a dynamic organ actively sending chemical text messages to our internal organs, it makes you wonder, does our skeleton possess a literal memory of our life's physical stress and diet?
Well, it certainly responds to and records that physical stress in its density architecture and its cellular activity. Every load you carry leaves a mark.
But what if it goes further? Is it possible our bones are constantly whispering biological instructions to the rest of our body? Making our skeleton an active, secret director of our overall systemic aging, it completely flips the script.
It suggests the foundation of the house might actually be telling the thermostat how to run.
So the next time you take a step, don't just think of your skeleton as a passive coat rack. Think about what those millions of cells are whispering to the rest of your body right now. Thank you for taking this deep dive with us today.